everyone. Today we're joined by Brandon Webb, our infectious disease physician here at Intermountain Healthcare. Brandon, thank you so much for joining us.
Absolutely.
Today we're going to talk a little bit about COVID-19's latest updates and what you guys can see that's been happening. So we are up to 1,738 cases as of this afternoon. Are we seeing an increase of cases because of testing capabilities?
A little of both, actually. Yeah, so the number of tests available statewide increased over the weekend. And when you look, you tend to find. But we're also seeing increased community transmission as well, as expected. So a little of both.
So, and for testing too, have our qualification changed for how we're actually testing people? Has that process changed at all, or has it still kind of stayed the same?
Still the same. We still are preferentially testing people who have symptoms that are compatible with COVID-19. And just to refresh, those symptoms are fever or cough or shortness of breath or body aches.
And a lot of people have been asking for more details on the symptoms. They're a little bit confused as to what a dry cough may feel like, or if they have allergies right now, or if they have the flu. Can you kind of go into more detail about what COVID-19 specific symptoms feel like?
Absolutely, yeah. We are still seeing a lot of people in the community who have some of those symptoms and are tested and test negative. And that's because there's a lot of overlap between COVID-19 and other community respiratory conditions, including seasonal allergies, which are increasingly common as we move into the pollen season. COVID-19 as a classic syndrome in almost 80% of cases has one of fever, cough, shortness of breath, or body ache. And the cough is usually preceded by 24 to 48 hours of what I like to call feeling crummy. Most people start feeling fatigued. And then when the cough does start, it's typically a dry cough. And usually fever starts, if you're going to have fever, which more than half of patients do, around 24 hours after the cough starts. That's the typical presentation. There are some atypical or odd presentations of COVID-19 as well. One is the loss of smell, which we are now recognizing is present in about a third of patients who test positive. Another is that in many patients, in addition to the fever and the cough, they have some gastrointestinal symptoms.
So if people think that they have COVID-19 and these symptoms are present, what's the process for them going to get tested? What are some things that they can do to actually find out if they have COVID-19 or not?
Yeah. It's always preferable to check in with a healthcare provider. And so whether you do that via a symptom checker, there are several of those online, or via one of the several telemedicine platforms, or by calling your primary care physician. Those are all acceptable ways of checking in. And what that does is it allows a healthcare professional to evaluate your symptoms and help to not only guide you towards testing if that's appropriate, but also to help manage your symptoms.
And if you aren't able to get tested, say you don't qualify, or for some other reason you can't get tested, you can't leave your house, there isn't a location closest to you, what are some recommendations that people can do to kind of self-treat the symptoms if they do have them?
Absolutely. Really two things. So still, more than 85% of cases of COVID-19 are mild enough that they don't require hospital level of care. And so if you don't have risk factors for having severe COVID-19, which include advanced age and medical conditions like chronic lung disease or high blood pressure or diabetes, if you don't have one of those high-risk features and you have mild symptoms, the good old-fashioned treatment is still the best. Rest, staying well hydrated, keeping a close eye on your symptoms. There are a couple of symptoms that we want you to watch out for in particular, and the most important of those is the development of shortness of breath. Mm-hmm. So patients who have been around someone who has COVID-19 and for whatever reason can't be tested, or if you've been tested and you know you have COVID, if you develop shortness of breath, that's a reason to contact your healthcare provider.
Yeah, I mean, a medical emergency is still just that, a medical emergency. And I think people need to understand that if they're requiring urgent care, we're not going to turn them away. A hospital is still a safe place to come. So shortness of breath is something they should probably be very much so looking out for.
Exactly.
Another situation that came up is after testing positive and quarantining for the correct amount of time, are you able to resume life as normal as possible? If you're an essential worker, can you go back to work? What are your recommendations after you've passed that period of getting over the test, or getting over the illness, I should say?
That's a great question, and it's very important, especially for those who are in essential industries. The CDC has very specific recommendations on when you can return to work. And on the CDC website, they give very specific guidance on how many days since your last fever, how many days since the onset of your symptoms. And so if you have questions about when you can return to work or when it's appropriate to come out of strict self-isolation after you've been diagnosed, those are questions that are best addressed by your primary care physician or a healthcare provider who can review those CDC recommendations in detail.
We just got a few questions about the symptoms as well. Back to that. Someone wants to know what a dry cough specifically is, or what it feels like. You probably have a cough when you usually have a cold. So what is the main components of a dry cough?
Yeah. A dry cough just simply means that you're not bringing anything up with the cough. And typically that type of a cough is what most patients with COVID are describing in the early phases. And then as the disease progresses, it can be a more what we call productive cough, which is a deeper chest cough.
And a fever is something that is not always necessarily there. Is that correct? What's the percentage of COVID-19 positive people that have a fever? Is it something that you should always be looking out for if you think you have the COVID-19?
Yeah. Between 50 and 70% of patients have a fever by the time they're tested. And by the end of their symptom course, almost between 80 and 100% of patients will have had a fever. So it is common, but it's not always present at the beginning of the symptoms.
That's good to know. Yesterday during our Facebook Live, we talked a lot about wearing masks in public. The CDC just came out with a recommendation that you should be wearing masks in public. Can you reiterate why that recommendation was made and kind of what your thoughts are on that?
Yeah, I think there's two really important points to clarify. The CDC recommended wearing fabric face masks or face masks that are not used in the healthcare setting, because it's important that we reserve the specialized masks that healthcare workers need to wear for the healthcare setting. The CDC recommended wearing homemade masks in settings where it's hard to do social distancing. So when you're in public and you're in an area where you can't maintain 6 feet away from other people, then wearing a mask is helpful. And it's helpful for two reasons. The first is that we're recognizing now that more and more people in the community may be asymptomatic and yet positive. And those are patients who can potentially spread the disease. And by wearing a mask, that cuts down on the community transmission. The other thing that wearing a mask does is it helps to remind us not to touch our mouth or our nose. And that is one of the single most important ways to prevent getting COVID and any other viral infection.
And you probably shouldn't be adjusting the mask once you put it on or touching it at all. Is there a process for anything that you should do once you take it off? Does the CDC have good recommendations for that? If you wear it for a day, should you be discarding it or?
Yeah, great question. Again, remember, primarily COVID-19 is spread either by being close to someone and breathing in those droplets that are near in close proximity, or by touching surfaces and then touching our mouth or touching our nose. And the mask is a way of reminding us not to touch our mouth or our nose. But if you've touched surfaces and your hands are contaminated and then you fiddle with the mask, you are putting yourself at risk by touching in and around your mouth and nose by playing with the mask. The correct way to remove a mask is by removing it from the areas of the mask that are far away from the mouth and the nose. So if there's loops around the ears or if it ties behind your neck, you untie that or you remove the loops while at the same time keeping your hands far away from your mouth, your nose, your eyes. And then it should go in the washing machine immediately after wearing it.
That's really good to know. And another important part probably about wearing the masks or just in general is about the hospitalization of the patients right now, and that we're at a pretty steady number of cases that are actually going to the hospital. Can you speak a little bit about how Utah's doing in terms of that?
Yeah, that's a really good point because we're all watching those new cases every day. And we're watching that increase and oftentimes fluctuate. So if you look at the Utah Department of Health website, you'll see that the number of new cases has fluctuated widely over the last couple of days. That may in part be due to fluctuations in number of tests done and when those tests are reported positive. But more so than the total number of cases, the number that we're watching very closely are the number of cases in the hospital, because we are at this point very good at making the diagnosis of COVID-19 in patients who have required hospitalization. And it's that number that helps us to project whether we're on track to overwhelm the healthcare system or whether our social distancing and our stay safe, stay home initiatives are helping to flatten that curve, and by doing so, prevent overwhelming our healthcare infrastructure.
Yeah. A lot of people also think that they potentially had COVID-19 at one point and weren't able to get tested or testing wasn't available yet. We've gotten a few questions about the antibody test and if it's available yet, if it's going to be something that's widely available. Can you speak to that at all?
Absolutely. Yeah, I'm glad that you asked that because remember, COVID-19 is now one of 5 coronaviruses that can be present in the community. The other 4 are common causes of the cold. And these antibody tests, if not designed correctly, will actually detect that you've been exposed to those other cold viruses, which could give a false positive. Even if you've had COVID-19, if you use one of those antibody tests too early, your body won't have made antibodies, and so that test can also be false negative. So in general, those antibody tests are not as accurate for detecting people who have ongoing or active symptoms. But as we get good quality FDA-approved tests that selectively test for the SARS-CoV-2 virus, those tests will become useful, and we will start using them to get a better look at how many cases truly have been present in the community and how many of our healthcare workers have been exposed. And that gives us a better idea of whether we're developing something called herd immunity, which is sort of a natural barrier that these pandemics run up against.
Is there any timeline on when those tests can be expected to be more widely available, or is it still something that everyone is working on?
Yeah, there are several that have already been FDA approved, and laboratories are now placing orders, and it's up to the manufacturers of those tests to be able to fulfill the orders. And obviously they are in high demand right now. So laboratories statewide right now are trying to place and fill those orders and make those available to patients, but they're not yet available.
Well, thank you. Thank you so much for joining us today. We really appreciate it. And if you guys would like to speak to someone about COVID-19, you can call our COVID-19 hotline at 844-442-5224, or you can use our online symptom checker on our website, which is at intermountainhealthcare.org. It's located in the bottom right-hand corner. Thanks, everyone. We'll see you next time.